Thank you for that question. It's a very important one in terms of the way people are feeling as numbers increase and as in some countries the situation gets worse before it will get better. What is very important for everyone across the world is to know what they can do to protect themselves and what they can do to protect their families. And we need everyone to be well informed. And it's important that everyone knows where to get good, reliable information, whether that's through WHO, to know how to protect yourselves and your family, or whether that's through your national governments. Not only to know how to protect yourself, but know what is the plan. You know, what are the plans of the government that are being enforced, and to know what your role is in playing that. It's important that that fear that people have, which is normal, be used in a productive way. Turning that fear, turning that energy into ways in which you can keep yourself busy. If you have to stay home because of national measures, you know, just because we have mentioned physical distancing, it doesn't mean that you have to be socially disconnected with your loved ones. So find ways in which you can communicate with your loved ones and your families to keep that connection while you're still being physically apart. Practical things we've been mentioning are washing your hands, making sure that you do good hand hygiene, and if you don't have access to soap and water, to use an alcohol-based rub. Make sure that you use your respiratory etiquette. You just heard the 5 from the video just now. Making sure that you don't touch your face. These are things that everybody can do. Making sure that you keep your distance from individuals, especially if you are outside of your home, making sure you're keeping your distance from people. And if you're feeling well, stay home.
Thank you very much, Dr. Van Kerkhoff. The next question is for Nobu from Jiri Press. Nobu, are you on the line?
Yeah, thank you. Do you hear me?
Very
Hello?
well, please go ahead.
Okay, thank you very much. My name is Nobu from Jiji Press, Japanese news agency. My question is about Japan. If you look at the official statistic of Japan, it's obvious that reported cases in Japan is much less than other big population countries. But there are some critics saying that the scope of tests carried out there is not enough. So the reality of the infection is not reflected in the official statistic. But on the other hand, the hospitals or clinics in Japan are not overloaded, so there are not so many patients with suspicious symptoms. So I'm a bit confused if Japan is doing well in containing the virus, or what we are seeing is just a tip of iceberg of the much bigger infection. So what's your view on this topic? Thank you very much.
So I can start with that. So what we know, I just touched my face. I shouldn't touch my face. What we know works in countries is countries' aggressive actions in terms of finding cases, testing those cases, isolating those cases, treating them, and making sure that there is comprehensive contact tracing. And we have seen that in Japan, and we've seen that in a number of countries. We know that when contacts are identified, if they are quarantined and then followed so that they are tested if they develop symptoms, we know that that is a very effective way in which we can prevent onward transmission. We know that mobilizing your population and getting your population to be involved in this response, performing all of these actions of personal measures and hand hygiene and respiratory etiquette, staying home when necessary, we know that that works. But testing is a key part of the strategy globally. And you've heard the Director General emphasize, and you've heard Mike and I emphasize the need to do testing and to do this strategically, making sure you're focusing on your suspect cases and that you're testing your contacts who develop symptoms. These are fundamental actions that need to be part of a comprehensive approach all countries need to take to tackle this virus. And we have seen in several countries the effectiveness of these measures in terms of a reduction in cases. We've also seen in a number of countries they're looking for additional cases through existing respiratory disease systems. For example, looking at their ILI or their influenza-like illness surveillance systems that have been established for influenza. several countries are looking at those individuals who have respiratory disease, who show up through those those surveillance systems to test for COVID-19 to see if the virus is circulating. And we're gaining good insight from those countries to find out how many of those are positive, and it seems to be low in several countries that are doing this. So it's a comprehensive approach that we need all countries to take, outlining through testing, case identification, contact tracing, making sure these public health measures, these physical distancing measures, strong government leadership, and all of government approach have been successful in reducing transmission in several countries.
And now we have Pamela managed to send us her question by text. This is Pamela.